Hi there, thanks for taking the time to view our video. We're making this video because we're inundated with calls at the moment regarding using our artificial intelligence to help with the COVID virus. Please bear with us, this video is not going to be as polished as we often are. Again, because we're being a little bit overrun. But we do want to get the message out there that we can help and that we're available. Sue is designed to be a simplified artificial intelligence that allows experts to amplify their decisions and to spread their decisions. Now, the idea being this: throughout the spread of this virus, situations are going to become very, very fluid, and different decisions will need to be taken in different circumstances. What I'd like to do is just show you how Sue can take a simple decision like, should somebody have a test? It's impossible to test everyone in the country every week. Somebody has to take a decision on limited resources. Now, what would normally happen is that people would sit in a committee, decide on a set of rules, and then they would publish those rules as best practice and they would distribute them, except that that kind of process can take 4 or 5 days, possibly even weeks. And then situations are changing too quickly at the moment for people to actually do it that way. So what I'm going to do is go into botsue.com, and I'm going to make a little decision-taking module with the intention that it will decide if you should have a blood test for corona as well. So I'm going to click Add New here. And we're going to go through a 5-step process, starting with defining the variables, which means we're going to tell Sue what decision it's going to take, what the possible outcomes are, what information we have at our disposal to take this decision, and then we'll go to step 2. We'll teach Sue how to take the decision by answering its questions. In step 3, it'll visualize itself for us. And in step 4, we can already start using it. So the name of my model is going to be Corona Test. And the next thing I'm going to do is tell Sue what the outcomes should be. So the first thing I'll say is, what is the question I want to answer? Which in this case, should I test this person? My possible answers are going to be yes, no, or to investigate further. Now, it's really important to realize that you can put anything as an answer here. So you don't only have to use Sue for yes, no, and investigate. You could have said quarantine, hospitalize, isolate. You could have gotten a numeric output, such as the dosage you should give of an antibiotic. The most important thing to remember is that you customize this yourself, and if circumstances change, you can come back here and change the possibilities. There's a large concern in certain countries of running out of antibiotics. There is no point having a model that prescribes an antibiotic when it's not available, or a CT scan or an MRI scan when the machines are full. You just can't get in. And that will render the whole exercise useless. The beauty of this is that in the same sort of time it takes us to make a model now, if a circumstance changes in one of the outbreak locations, you can still keep best practice going within the constraints of each medical system in each area. The next thing is variables. Now I'm going to tell the system what I need to know to take this decision. Now, everything you need to know, again, is a flexible thing, may or may not be available. Of course, one of the big criteria here is age. I'm just going to paste them in to save myself a little bit of time. So ranges 0 to 20, 20 to 40, etc., etc. The next thing, I just want an idea of how big the local threat level is. Do I have comorbidities? Now, this is a list of comorbidities that apply quite well to South Africa, where I live. Obviously, you're welcome to put in the ones that fit your area, or to get a copy of this model from us and add your own. We have a measure of overall fitness, and this is a very soft measure, just a rating from 0 to 10. Does the person have a high volume of contact with other people? There's a huge difference between somebody who is a waiter in a restaurant and somebody who sits behind a computer in a cubicle. And lastly, do they have any flu symptoms? So here, any combination of these questions has to lead to one of my 3 outcomes. What I'm going to do is confirm the model and build it. Now, the thing to remember is you can always go back if you want to. So you can change this thing dynamically as you're working. What happens next under train is that Sue starts to ask us questions. So what Sue is saying is, I have a 60 to 70-year-old man, high local threat level, diabetic. He's quite fit, he's a 6. He has the contact with a lot of people and a sore throat. And I tell Sue, yes, I want this guy tested. My next question is a child between 0 and 20, young person, in an area with a low threat level, has TB, extremely unfit, doesn't meet a lot of people, but they're coughing. And this person, we're not going to test. I'm not a medical doctor, so I wouldn't go using my model. But obviously, this thing needs to be trained by the smartest minds you have. And then any minds that you have will be taking the same quality of decisions as your experts. And this will create a moving standard of care throughout your healthcare system. When I'm done answering questions, I click Build. The first thing that you see is a mind map, so you can always show other doctors or other people what you've done and how you've approached the problem. Different places will do it differently. In step 2, there's a decision tree. The decision tree often doesn't work simply because the way you take the decision isn't based on a decision tree. In section 3.3 levers, it will show you what the main drivers of your decision are. And that's really important. You may wish to change them depending on how the system is working. The proof of the pudding comes in step 4, where we use the model. So now I'm asking the system, 20-year-old, low, whatever, and it says I need to refer the patient. Then I get a new patient, 40 to 50 years old, low local threat level, diabetic, very, very fit, with no daily contacts and no flu symptoms. When I ask, the system says no. If I want to know why, I can simply click on the answer itself, and Sue will explain to me exactly why. It will say, look, you've asked me for a 40 to 50-year-old man, low threat level, diabetic, overall fitness, etc., etc. Your answer number 19, same age, same threat level, he's got TB instead of diabetes, same fitness, same everything else. I'm 98% sure this guy is in the same class as that one. If you want to differentiate between TB and diabetes in this case, because you may not want to in all cases, with Sue it's as simple as clicking on change the result. And what it will do is give you the possibility of either changing your previous decision or adding a new decision. So if this guy is a yes or a refer, I change it to refer, click save. And so you can constantly augment Sue and constantly improve the quality of your decisions as you make new discoveries. In a highly dynamic situation like the one we have with COVID, it can be ideal because we're going to be learning all the time. So we just wanted to give you a little overview of how the system works on the medical front. For more information, please consider popping into our website, analicat.com. There's another video on Sue which you could watch. And mostly I wish you all the best of luck with what's coming and good health.